Hello. In today's video, we will discuss the management of the PPH. But before that, I would like to talk about 2 points. One is prostaglandin and other is carbetocin. Okay. So prostaglandin, according to GTG guideline, prostaglandins are not superior. Okay. Prostaglandins. Wait, I'll adjust the camera. Prostaglandins are not superior to oxytocin. Okay, so you cannot give prostaglandin and hope that it will prevent the PPH. You can give prostaglandin either IM or in the form of misoprostol along with the oxytocin, but you cannot give it alone for the prophylaxis of PPH. Second thing is carbetocin. Okay, so carbetocin, when given prophylactically for SVDs and C-section to prevent PPH, it did reduces the blood loss, and the risk of PPH in C-sections, but there was no effect of carbetocin in preventing PPH in SVDs. Okay, so I wanted you to keep these points in mind, that carbetocin prevent PPH or reduces the amount of blood loss in C-section but not in SVDs. Now we will talk about management. Okay, so according to this guideline, the visual assessment of the blood loss, as we said, that if the blood loss is between 500 to 1000, we will call it minor, and if it is between 1000 to 2000, we will call it moderate major, and if it's more than 2000, we'll call it severe major. But you cannot depend on this visual assessment of the blood loss. Okay, visual assessment of blood loss is not sufficient. What we have to do, we should clinically assess the patient as well. Okay, because at minor, moderate or severe amount of blood loss, there are specific features which are associated with the blood loss. We should look for those features as well in promptly diagnosing the PPH. So what are the features? We will discuss it according to the blood loss. Up to 1000 ml. Okay, up to 1000 ml. BP and pulse is maintained. Okay, 1000 to 1500 ml, a patient will experience tachycardia, slight fall in systolic blood pressure, and slight tachypnea. Okay, this feature will be present but not in moderate form. But if the patient is having anemia, she might develop tachypnea, systolic drop in systolic BP and tachypnea even at 1000 ml. If the patient has low BMI, she can develop these symptoms even at less than 1000 ml. Okay, so we should consider all the factors when we clinically assessing the patient. Tachypnea. And if the blood loss is more than 1500 ml, what would happen? There will be systolic BP would fall below 80. There would be worsening tachycardia and tachypnea, and along with these, altered mental status. Okay, so by using these clinical features, you assess the patient. Okay, first step in the management is assessment. You assess the patient, either she is in the minor PPH or in major form, either she is in severe PPH or in moderate PPH. Okay, so first step of the management was assessment. Second is communication. Okay, this one is very important. Communication with whom? Communication with women who is in PPH. Okay, this is very important. And second, communication with multidisciplinary care team. Okay,